I'm Evan Smith, the CEO of the Texas Tribune, and I want to welcome you to the 2022 Texas Tribune Festival. This is the 12th year our nonprofit news organization has been convening the biggest names in politics and policy from across Texas and around the country to discuss the most pressing issues and the most interesting ideas of our day. At the Tribune, we believe events like this one are journalism, consistent with our public service mission to educate and engage our friends and neighbors. If you believe in that mission, if you believe a more informed Texas is a better Texas, become a Texas Tribune member. Go to texastribune.org/join to give during our fall pledge drive, when the first $50,000 in contributions will be generously matched by our friends at the Lowy Law Firm in Austin. Whether or not you're a member, we're excited you're taking part in our latest and greatest Trib Fest, which has more than 350 speakers and more than 120 compelling interviews and panel discussions. I think you'll especially enjoy this session, one of 7 we're presenting virtually, featuring Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases and chief medical advisor to the President of the United States. Dr. Fauci was, of course, the public face of the federal response to the coronavirus pandemic, variously celebrated and criticized as he guided the country through a once-in-a-lifetime public health emergency. A native of Brooklyn, New York, Dr. Fauci attended the College of the Holy Cross and Cornell University's Medical College, where he graduated first in his class. After completing his residency in internal medicine in 1968, he joined the staff of the National Institutes of Health as a clinical associate at NIAID. There he has remained, rising through the ranks to become its director in 1984. Until 2020, he was best known for his work on the AIDS epidemic in the early 80s. COVID-19 changed that and changed everything. My conversation with Dr. Fauci was recorded on Thursday, September 15th, less than 4 weeks after he announced he'll step down at the end of the year, capping more than 5 decades of government service. Dr. Fauci, welcome. It's an honor to be with you.
Thank you for having me. Good to be with you.
So, Dr. Fauci, I thought we'd start with this bit of breaking news. The world had its lowest COVID death toll last week since March 2020. The Director General of the World Health Organization put it this way: the end of the pandemic is in sight. Do you agree?
Well, partially, Evan. I don't want to be in disagreement with him because I know where he's coming from and I'm on board with that. But I think we have to be careful about wording that would get taken out of context. We can see the cases throughout the world coming down. We're seeing it here in the United States with cases, hospitalizations, deaths, unfortunately, are lagging a little bit slower than I would like it to see. But everything, with few exceptions throughout the world, is going in the right direction for any of a number of reasons. And I believe that the Director General was saying that because we know we have a degree of global immunity, either for people who've been infected and have residual immunity, or people who've been vaccinated, boosted, and maybe vaccinated and even infected. So it isn't like it was in the winter of 2019-2020 in January and February of 2020. And then after that, we had an explosive phase. So he was saying, I believe, we're out of that explosive phase of the pandemic. But the reason I'm hesitant to say that the end of the pandemic is in sight, because we have experience now over 2.5 years, painful experience, thinking we were going down, and then a new variant appeared. And the new variant turned the tables on us. Remember when we thought in the summer of 2021 that we would get into the 4th of July weekend and the summer, and along came the Delta variant. Then we got pretty good control of that, thought we were in good shape, and then came the Omicron variant.
Right.
So if we stay within the framework of sublineages of Omicron, like we're in beta 4.5 now, BA 4.5, BA.4/5 now is dominant in this country. So we're doing pretty good. And our
Yeah.
next boost will be our next vaccine injection will likely be a bivalent BA.4/5. If we
Right.
stay in that realm, we're good. But we can't declare victory until we get the level of transmission throughout the world so low that the chances of a new variant would be much less.
So the Director General is talking, of course, about deaths. I wanted to ask you, what is your metric for success at this? Is it deaths? Is it hospitalizations? Is it a certain threshold hit of vaccinations? How do you analyze the numbers and say this is heading in the right direction?
It's all three of the above with a very heavy emphasis on deaths and hospitalization and severe disease. No doubt about that. Right. However, there's one wild card in this, Evan, that we have to pay attention to, and that is infection. Even mild to moderate infection can lead to a syndrome called long COVID in a certain percentage of people. So getting infected for a certain proportion of people, we don't know whether that's 5%, 10%, some studies show as high as 20%, will have a residua of impairment of normal function that can last for months, if not longer. So we would like very much to get such a control over this that even the infection rate is very low. But in answer to your specific question, you're absolutely right. Death and severe disease is the most important parameter.
That's the big metric. Now, of course, there's the reality of the statistics and of the data, and then there's the perception of the public as to whether this thing is over or not. A couple days ago, there was a poll by Axios and Ipsos that said the public's perception of personal risk is at a low point in the pandemic. And of course, I think to myself, that's exactly the moment where this thing comes back at us, when we're least prepared to prepare for it, when we're irrationally exuberant. Do you worry that the public has decided this is over and that itself is a threat?
I do. I worry about that from two standpoints. For those who are young and healthy, who have an unlikelihood that they are going to get a severe involvement, particularly if they don't have any underlying conditions and they're young. Because if you look at those who get severe disease leading to hospital and death, it is heavily weighted towards the elderly and those with underlying, particularly immune compromised conditions. But a young person who doesn't care about getting infected and says, what's the difference? That person may inadvertently transmit it to someone who's vulnerable, who may go on to a severe disease. So there needs to be some sort of communal understanding and responsibility that we all have a role in keeping this outbreak down. And that's the reason why you don't want to completely throw caution to the wind. I'm not talking about mandating. I'm not talking about closing things. I'm just talking about being careful in indoor congregate settings and getting people vaccinated. I think that if as a country, we get many, many more people vaccinated, we will go a long way of keeping this level down.
And you're not, so this is helpful. So you're not recommending more public health protocols necessarily than what we have now. It's more of a general awareness. So I want you to go back and I want you to look for us at the decisions we made and evaluate, not based on what we knew then, but what we know now, if we did the right thing. You mentioned not closing anything down now. Of course, there's still a lot of controversy, a lot of reverberation about the decision to close schools. Was that the right decision in your mind, looking back?
Well, first of all, the answer is it was a right decision at the time. And it did have collateral consequences. No one can deny that keeping children out of school has negative impact on the children. And that's the reason why, as soon as we had a situation where there was better control and we had vaccines available for the general population, myself and my colleagues in the public health sector said we've got to do whatever we can to keep the children safely in school. And that was particularly after vaccines became available, like vaccinating the teachers, surrounding the children with people who are vaccinated, getting good ventilation, where appropriate, having children wear masks.
Yeah.
But it was a very difficult decision because whenever you shut something down, be it the 15-day shutdown early on and then the 30-day extension, remember flattening the curve?
Right.
The reason for that should never be shutting down for the sake of shutting down. It'd be shutting down so that you can put yourself better positioned to reopen up as quickly as possible. So when there were no vaccines and the hospitals were getting overrun in New York and in other places, you really needed to do something to put an abrupt stop to what was going on. Shutdowns then should never have been prolonged, and they weren't prolonged. And when you do shut down, it should be for a purpose, either getting the vaccine ready to be deployed. Right now, where we have vaccines and we have good public health capabilities, I don't anticipate any reason to ever shut down again.
No reason. Were the consequences that we felt, we talk a lot about learning loss in Texas. There were a bunch of other consequences of closing the schools down. Were they worth it, I guess, knowing what you know?
Yeah, I believe so for a number of reasons. First of all, there is this understanding that because children do not get a severe disease as a cohort in general as the elderly individuals and those with underlying conditions.
Yeah.
We still lost 1,400 children, and there are still a considerable number of children who get the syndrome called MIS for children, or multi-system inflammatory disease of children.
Yeah.
There is still long COVID. So although you have to be aware and not deny that there are deleterious consequences for prolonged periods of time for keeping children out of school, remember the safety of the children is also important. So it's not black and white, Evan. It isn't completely right or completely wrong.
Right.
The people who have concern about closing schools are perfectly appropriate in that concern. And that's the reason why I have said very, very often, we need to do everything we can to make sure the schools are open and safe.
So there's a version of this conversation, should we have required masks? Should we have required social distancing? Was our quarantining protocol an overreaction? Would we have been better off mandating vaccines? I want to ask if you have sympathy for the frustration, not just of your political enemies, we'll get to them in a second, but of the average people who feel like the guidance from the government was constantly shifting or sometimes contradicted things that the same entities had told us we needed to be doing. I'm thinking about a story I read in the New York Times in August, last month. There was a version of it every place, and the headline in the Times was Walensky, this is Rochelle Walensky, the director of the Centers for Disease Control, citing botched pandemic response calls for CDC reorganization. She was saying that among other flaws, public guidance during the pandemic was confusing and overwhelming. I just wonder if you think we got it right. I know it's very hard to say it. It's also sort of easy on the back end to hindsight.
Yeah.
Did we botch this, Dr. Fauci?
Certain aspects of it were botched, and I think what Dr. Walensky was referring to, for example, was the issue with the tests, where they did not get the commercial involvement in the tests quickly. They stuck to their own tests. Yeah. They admit, appropriately so, that that was a mistake. The idea about guidelines coming out saying people may do something instead of should do something, people didn't have any idea what that
meant, right?
What that meant. But one of the things that complicates it, and I have absolute understanding of people's frustrations when the normal, everyday, intelligent person in the street looks at what's coming out, may not fully appreciate that things change with regard to recommendations because we were dealing truly with a moving target. Because what happened is that knowledge evidence and data evolve. And as it evolves, you have to be flexible enough to change. And that's what science is all about. It's a self-correcting process.
Yeah.
The data that you have today. So take a look at it. Early on, the first thing everybody thought was that this was not easily transmitted from person to person. It was animal to human, but not easily. Then we found out it was easily transmitted. Then we found out it was very easily transmitted. Then we found out it was aerosolized transmitted. And then we found out that 50 to 60% of the transmission came from someone who had no symptoms at all.
Yeah.
So the original model that was used for respiratory diseases, that if you're sick, stay home, and if you feel well, it's okay to go out. You don't need to wear a mask. We didn't know masks worked outside of the hospital setting. There was supposedly a shortage of good masks for the people who were taking care of individuals. And it was completely unaware that most of the transmission was transmitted with people without symptoms.
Yeah.
At that point, it was incorrect to say don't use a mask, but it was based on the information as we knew it. As soon as it became clear that this is spread easily by aerosol, there are plenty of masks, and many asymptomatic people can transmit, then all of a sudden it became very clear you absolutely should be wearing a mask. So if I'm the man in the street saying, wait a minute, first you tell us no, and then you tell us yes. Of course, that's understandable confusion. But that's the nature of scientific evidence that changes.
Things change. I mean, it seems weird to ask the question that I know has been asked of you for the last 3 years, why were we not better prepared? I mean, this is an unprecedented or nearly unprecedented. I mean, you have to go back to 1917, 1918 possibly for the last time we had something of this magnitude. But in some ways, even that doesn't really prepare you, the experience of 100 years ago, for what we encountered.
Yeah.
I mean, look, there was famously, Dr. Fauci, a pandemic playbook developed by the Obama team that specifically cited novel coronaviruses as a potential cause for concern. I mean, on some levels, I want to say, it's not like we hadn't imagined this might happen.
Yeah.
So why were we not better prepared when it actually did happen?
Sure. Okay. Evan, that's a great question.
Yeah.
And let's unpack it a little, because there are different types of preparedness. There's public health preparedness, and there's scientific preparedness. My responsibility as the director of the National Institute of Allergy and Infectious Diseases was to do the scientific preparedness.
Right.
Get the basic and clinical science so that we can move quickly to develop countermeasures in the form of vaccines and therapeutics. And because of the investment, decades of investment in biomedical research, in the scientific preparedness, that was unprecedentedly successful, where we were able to get a vaccine from the time we knew there was this new virus in January to the time we had a vaccine that was 94 to 95% effective, going into the arms of individuals within 11 months. Never would have been imagined to have done that quickly and that successfully.
Yeah.
So that part worked. But the public health preparedness, which we were judged by the Hopkins School of Public Health to be the best prepared country in the world, as it turned out, when you had an overwhelming, unprecedented pandemic, certain things worked from a public health standpoint, but certain things did not. And as it turned out, when you're talking about the public health aspect, not the scientific, which worked incredibly well, the public health aspect, there's preparedness and there's response. And this is what we learn from our military colleagues. And I got this from a number of very high-ranking military personnel who say, when you go into a war, you have to have a plan. But when the guns go off, the fog of war comes in.
Yeah.
And you got to be able to be flexible enough to be able to do things that were not necessarily in the plan. And that's where I think things went awry, because we were doing things disparately. We live in a very big country that is very different in different regions. And instead of having a uniform approach, you know that particularly in an arena of political divisiveness, we were having states that refused to recommend vaccines.
Well, in fact, Dr. Fauci, you had 50 responses.
Right, exactly.
Right? You didn't have one response.
Exactly. And that was the point. And I'm not blaming it on anybody. There's no blame here.
But that's just how it goes.
But if you look at the time when you needed to recognize that you're dealing with a common enemy, at that same time, to have such political divisiveness in the country is antithetical to a good public health response.
So you bring up the political response and the divisiveness of this. I said I'd come back to your political enemies. Let me go there now. If the Republicans win the majority in the U.S. House, they have said explicitly they plan to investigate you and your handling of the pandemic. One of many quotes to that effect, I chose our own U.S. Senator Ted Cruz. In January, a GOP Congress should hold Fauci fully accountable for his dishonesty, corruption, abuse of power, and multiple lies under oath. What is he talking about, Dr.
I have
Fauci?
no idea. Evan, I don't have a clue of what he's talking about. And that's purely on the basis of political organizing the base against a boogeyman. They've picked out me as—
You're the boogeyman, right?
I'm the boogeyman. I understandably am a boogeyman because I had to do something last administration that I did not relish. I did not like the idea that in order to maintain my personal and scientific integrity, and in order to fulfill my obligation to the country as a public health official and a scientist, I had to publicly disagree with several of the things that the president, who they follow to the last word, was saying. I mean, people think that that was political for me. I have a great deal of respect for the office of the presidency, and it really, in my mind, was very uncomfortable to have to contradict what the president was saying. But that immediately made me public enemy number one to the far right. And that has continued because right now, I mean, we've had situations where, certain senators say, fire Fauci, put Fauci in jail. And then right beneath it is donate 10, 20, 30, 50, 200 million, $200 to my campaign.
So they're fundraising against the boogeyman. This is
fundraising against the boogeyman. I understand that.
Politics.
But Evan, it is what it is.
Yeah.
I'm not a politician. I have never been associated with any political party. I don't have big, strong ideologies, but I have become the boogeyman of the far right.
So if they call you to testify, if Republicans do win back control of the House and they control the investigative or the oversight mechanism in the Congress next year and they call you to testify, will you cooperate?
Of course.
So you'll show up. They're not going to have to subpoena you. You're going to show up.
Evan, I have testified before the United States Congress between 200 and 300 times.
Oh, I've watched you and Rand Paul are America's fun couple. I've seen you all together. This is not something I know that's new to you, but you're saying if they do this in a formal capacity and ask you to come, you'll go.
Yeah, but there's one caveat I want to make sure we understand.
Right.
That if we're talking about honest oversight to help out, to understand what's going on and to make things better, I'm all in favor of cooperating. If you're talking about pure character assassination and ad hominem, I'm not so sure.
So there's a chance you would decline if the circumstances are the wrong.
Very unlikely I would decline. Very, very unlikely. Okay. I mean, I have see the thing, Evan, I don't have anything to hide, and I can defend everything that I've done. And I'd be more than happy to explain that to
Right.
them.
So why not? So why not go?
So why not go?
Yeah. Yeah. You were talking about President Trump a second ago. I want to go to President Trump and President Biden, your last two bosses. Can you compare and contrast them in terms of their approach to dealing with this pandemic? Now, obviously, they were doing it at different times. The pandemic came into all of our lives at a time when President Trump was in office. He was encountering it as a brand new thing, this unprecedented thing, in the same way that we were. By the time President Biden was in office, we had already had a couple of years under our belts, but nonetheless, there's a study in contrast, and I'd like you to tell us from your perspective what the differences were.
Evan, I'm sorry. I have a great deal of respect for you, but I'm not going to go there. And the reason I'm not, because that's tiptoeing into political arenas. And I don't want to do that. I don't want to be comparing presidents.
Right, well, but I'm not asking you to compare them substantively. I hear you. I mean, I'm just thinking back to all those shots of you in the White House briefing room when the president was President Trump, standing to the side but just behind the president on camera. And I'm thinking about how it seemed you were working very hard, to the point you're making, to not visibly react when you knew that every single American was reading into your body language,
right,
or reading into your faces. So you don't have a thought about, or willing to share with us a thought about what that was like, what that experience was like, beyond what you've said.
You know, I think I explained it, but let me succinctly repeat it a bit in a different context with regard to your question. I had to do something that was very uncomfortable for me because of my respect for the presidency.
Right.
It was uncomfortable to have to be getting up and saying, no, I'm sorry, but hydroxychloroquine does not work.
Right.
No, I'm sorry, but the virus is not going to disappear like magic. I didn't like to do that, but I had to do it. Right now, in the situation I'm in, I never have to worry about that because the science is the thing that drives what we're doing.
Right.
And I have
You mean what we're doing in the current administration?
In the current administration. I mean,
Right.
the first thing that President Biden told me when he called me up after he was elected and before he was inaugurated, that he wanted me to be his chief medical advisor and that he wanted to assure me that the science was going to drive what we do. And he wanted me to just stick with the science the way he knows I always have.
And has he lived up to that?
Totally.
This is what candidate Joe Biden said when he was running for president. The American people deserve an urgent, robust, and professional response to the growing public health and economic crisis caused by the coronavirus. That's what he campaigned on, Dr. Fauci. Do you think he delivered objectively over the last 2 years?
Yes, Evan, he has. But when you're dealing with a war, I mean, let's make that metaphor and that analogy, because when you're in a war and you have a general that says, I'm going to do everything I can to win this war.
Right.
And they do. But, you know, you invade Normandy and a lot of people get killed and people say, wait a minute, our soldiers are getting killed. You know, it's the negative consequence of a historic pandemic. But I believe very clearly that the president is fulfilling everything he said that he would do with regard to this outbreak.
Well, and to the very point you made about deaths at war, even if you have the best intentions and you execute on a plan and you go in saying, I'm going to do these things, the reality is that COVID deaths rose in 2021 to more than 415,000, up from 351,000 the year before because new variants emerged or because some people refused to wear masks. There were more deaths actually in the first year of the Biden administration than the last year of the Trump administration, right? That's true.
Okay, let's again unpack that, Evan.
Yeah.
Okay, so if you look at the deaths of people from COVID in the unvaccinated compared to the vaccinated and boosted, it's phenomenally different.
Yes.
That literally the chances of someone who's vaccinated and doubly boosted with the availability of drugs like Paxlovid, very, very unusual that someone would die. Not that we get infected. Infected is different, but that we get seriously ill. Then you look at the country, 67% of the people in the United States are vaccinated. That means 33% are not. Of the vaccinated people, 1/2 of them have gotten a booster, which means that 1/3 of them have only one boost. So when you look at the country and you look at the difference between vaccination in red states versus vaccination in blue states, there's a big difference. So you can have a president who does everything he wants to do. If the country doesn't want to get vaccinated, the country doesn't want to wear a mask in an indoor setting, there's not much the president can do about that.
Sure. Well, and in fact, you called out earlier the role of the states during the pandemic, the degree to which actions taken by governors or by legislatures made a difference in combating or prolonging the public health emergency. I'm still, marveling over the old Jeffersonian notion that the best government is closest to those being governed. But you had states tell counties and cities, for instance, in a state like Texas, what they could and could not do. And yet they also objected to being told what to do by the country. This ultimately was a big fight over local control, Dr. Fauci, wasn't it?
It was. And that was one of the things. There's a great beauty of how our country was put together with states' rights and the individual capability of states to do things because of differences between Maine and California, between Florida and Idaho. I mean, there really is a big difference. So there are things about that state's prerogative to do the way they want to do it that has value to it. But when you're dealing with a common enemy that can easily kill someone in Maine as they can in Texas or in Idaho, there needs to be some commonality of a unified approach to a common enemy. And that's not what we have seen with COVID.
It's kind of a great patchwork. It was a patchwork of inconsistent regulations and policies, right?
It was. And that's unfortunate because that's not the way you approach an epidemic, a pandemic that has already killed over 1 million Americans.
1 million people. There will be another pandemic, Dr. Fauci, right?
No doubt. I mean, I've been saying that for the almost 60 years that I've been at the NIH and the 38 years that I have been the director. It's happened before recorded history. It's happened in our own historical corporate memory. We're living through a historic pandemic now. Another one will come for absolutely certain. And that's
did we learn enough from this one to be ready or to be better prepared than we were this time?
Evan, I hope so. I hope corporate memory doesn't fade when you get a problem that you put behind you and then you focus on what you're dealing with now and you forget that you need perpetual preparedness. I wrote an article in 2008 with my colleagues that said emerging infectious diseases, the perpetual challenge. And the conclusion of that paper that I wrote is that a perpetual challenge requires perpetual preparedness.
Dr. Fauci, that's exactly right. I mean, it's hard to think that we would go through this again, having been just through these last 3 years. But it is what it is, and we're going to have to take it as it comes. You will be gone, though. You have announced that you're going to be stepping down from both your role at NIAID and as chief medical advisor to the president at the end of the year. You said you want to do other things. What do you want to do? What are you going to do?
Well, I look at what I've been through and how I can contribute further to society in the area that I might have an impact. And I'm going to take the experience that I've had over almost 60 years at the NIH and almost 40 years as directing the largest infectious disease institution in the world. And I'm going to use that experience to try and speak and write and get involved in projects that inspires the younger generation of scientists or people who are considering going into science, that they may want to consider a career A, in public service, and B, in public health. Because I don't want young people who might be considering going into science to be discouraged of going into science because of the kinds of things that they see scientists going through in somewhat of an anti-science attitude that we see in certain parts of the country and maybe a little bit in every part of the country. Going into science is an extraordinary experience that you can make a contribution to society. If science happens to be in the realm of public health, you can help individuals with something that's very important to them and to their families, and that is their health and their well-being. I'd like to encourage a lot more young people to do that. That's going to be the theme that's going to dominate what I do as I leave government service.
Wow. Well, good timing, I guess. We need that more than ever, Dr. Fauci. As you said, this is a weirdly anti-science moment, and if you're going to be a counter to that, then good luck to you. Well, we're out of time. I appreciate so much you joining us here at the festival again. Thank you so much. Thank you for your service to the country.
Thank you very much, Evan. It's really a pleasure to be with you again.
Thank you, and thank you to everybody watching at home. Enjoy the rest of the Texas Tribune Festival.